And here is your stem.
Mhm. I am ready.
Okay. So if you've read and understood, considering it communication skills station, please begin.
Hello, I am Dr. Ahmed Awad, one of the surgical doctor. I am calling the vascular surgeon to transfer case of lower limb ischemia. I am working for Mr. Mann.
Okay.
Just can I confirm that I am calling the vascular surgeon?
Yes, vascular surgeon speaking. Can you please summarize your case?
Yes, we have Mr. Tom. He is a 54 years old patient admitted to our hospital as a case of mild diverticulitis. For conservative management, IV fluid and antibiotic, he improved. But the problem, the patient developed a sudden severe left lower limb pain. After examination of the patient and doing the arterial duplex, we found the patient have acute limb ischemia. The patient have we did also some labs for him which show metabolic acidosis, ECG show AF. And also the patient have hypokalemia. For that, we are calling you to transfer the patient for definitive treatment urgently.
Doctor, why do you think your case is urgent? Why can't you wait till the morning?
Yes, our case is urgent because the patient of fearing of losing of his limb, so we need to transfer him urgently. We cannot wait for to the morning.
You said your patient is having atrial fibrillation on ECG. Don't you think
Yes,
you should be calling cardiologist and consulting him first?
yes, but the his condition is urgent, and he may lose his left limb because he have acute lower limb ischemia. And after that, we can review his heart problem and atrial fibrillation.
Okay, right. You also said patient has, okay, preventricular complexes. So don't you
Yeah.
think it's important that you should consult cardiologist? What if cardiologist can't come? How would you manage the patient meanwhile?
As the patient critical ill, we usually treat him or manage him according to CRISP protocol by IV fluid, also by oxygen, and also correct the potassium and electrolyte disturbance, it can correct the arrhythmia.
Okay, what do you think? You think the presumed diagnosis of diverticulitis is there?
In the view of the atrial fibrillation, it could be a mesenteric ischemia, as the atrial fibrillation can send some emboli to the mesenteric vessels. So we can put in our view or differential diagnosis is the mesenteric ischemia.
So are you telling me that patient could be having myocardial infarction?
We according to our now the patient have no chest pain. He have a lower limb ischemia, but in our ECG it doesn't show any change in his
What
ECG
are
showing
the
our
other
suspicion.
differential diagnoses that you will consider?
We can consider it could be compartment syndrome in his leg. Also, for his abdomen, it could be mesenteric ischemia, or it could be infective colitis. Also, it can be a perforation of viscous. But his examination, his tummy is soft and lax
So
for his abdomen.
have you done any scan for the abdomen?
We didn't do a scan, but we need to transfer the patient because he have. We can do it later on after transfer the scan for his abdomen, but we should transfer him urgently before the scan. We didn't do any scan for him.
So how is patient's abdomen now?
No, his
Is it
abdomen is
tense?
soft and lax. No. The patient's
Okay.
abdomen is soft and lax.
All
And
right.
I will do a serial examination for him frequently, and I will update you if there is any deterioration in his examination.
Okay, what about the patient's leg? What investigations are you going to carry out?
It is a clinical examination. His leg is pale and pulseless, uh, also cold. So the clinical examination showing a limb ischemia.
Yes.
Also, we did a duplex arterial sound that confirm or document the acute lower limb ischemia.
Okay. Other than arterial duplex,
We can do CT angio
angiography.
if we have
Yes.
a time. Yeah.
Yes. All right. So what is your plan of management?
My plan of management, as we said, crisp protocol, oxygen, IV fluid. Also, we can give him do some lactic acid. Lactic acid. Also, I will do a new ECG, a new ABG. Also, I will correct the potassium and metabolic acidosis. Also, yes, and for arrhythmia, we can control the heart rate or the rhythm of his uh, arrhythmia.
So, all right, for the sake of, okay, you said you'll do a new ABGs. Already
Yeah.
patient is having metabolic acidosis. How
Yes.
are you
Yes.
going to manage that? Which anticoagulant are you going to recommend for the patient?
Uh, Anticoagulant. I will, if the renal condition is normal, we can give him unfractionated heparin or low molecular heparin. If abnormal, we can give him unfractionated heparin.
Okay. And for the acute limb ischemia, how do you think patient should be managed?
Regarding the
Acute,
anticoagulant.
acute limb ischemia, yes.
For acute limb ischemia, he need embolectomy,
Embolectomy, yes.
thrombolysis or bypass, or can also he need also fasciotomy, prophylactic fasciotomy to prevent
Yes.
the compartment syndrome.
So how are you going to handle patient's family? What are you going to tell them?
I will call the family and tell him the patient have developed a decrease in his circulation in his lower limb. So we will transfer him to the other hospital for definitive management urgently. And his
Okay.
case is urgent, yes.
How are you going to transfer the patient to our
By blue,
facility?
by blue red ambulance.
Who is going to accompany the patient?
Uh, I will accompany the patient if I have another colleague who can cover me, or the ITU registrar or anesthesia registrar.
All right, okay. Send the patient over.
Okay, thank
Thank
you.
you. Right, good. Very good. So I